Welcome to Generation Digital Workforce, the podcast that's here to explore the role of robotic process automation and other digital technologies. Whether you're just getting started or you're looking for advanced strategies and tactics, if you're curious about where human and digital workers are coming together to transform the future of work, then this podcast is for you. All right, let's get into the show.
Hello, everyone. Welcome to this special episode of Generation Digital Workforce. I'm Lisa Hackbarth. Thanks for joining us today. As you know, if you're living on planet Earth right now, we're in the middle of unprecedented times. COVID-19 has changed the way that we all live and work, and organizations have had to make major, sometimes foundational changes, both proactively and reactively in response. There's a quote that I really hang on to during times like this by Mr. Fred Rogers. I know that probably many of you out there have heard it. He said, "When I was a boy and I would see scary things in the news, my mother would say to me, 'Look for the helpers. You will always find people who are helping.'" And if you've seen John Krasinski's Some Good News series on YouTube, you know how uplifting it can be to hear the stories of all the good stuff and all the helpers. So as I went looking for the helpers in my own world, I didn't have to go much further than my own now fully remote work community. And I thought, these are stories that the world needs to hear. Not only the helping itself, the generosity and the thoughtfulness, but also just the progress being made, I think is so encouraging and it needs to be shared. They say that necessity is the mother of invention. Well, as we all know, there's plenty of necessity out there right now. I know that we're trying to handle things like getting calls from call centers, just the overwhelm, getting all those calls answered. We're trying to figure out how to get people the funds that they need to keep their homes. We're trying to figure out how to help small businesses who are really the backbone of our economy stay in business. We're trying to help high-risk veterans get treatment without putting them at more risk by sending them to places where they might come into exposure with the virus. And we're trying to help get supplies where they're needed most. I mean, the list probably goes on and on. So I think this, though, is where humans shine. When problems come up, that's where we show up. We look at the tools in our toolbox, the technology available to us, or maybe not even invented yet, and we get creative. We start dreaming and tinkering and figuring things out. And as a result, there's innovation happening all over the place right now. And I don't know about you, but stories like this just really, I think, help bring a sense of hope for me. So I wrangled up a few folks who are on the digital front lines, and I asked them to share what they're seeing out there in the world right now. And now in the 3 interviews that follow, you'll hear how digital workers are helping in healthcare, banking, supply chain, call centers, and more, and how that all trickles down to help support organizations and small businesses and individuals. And you'll also hear more about Blue Prism's COVID-19 response program, which I think is doing just it's super cool. And I'm really excited for you to hear more about it. So in these interviews, I spoke first with Matt Juden-Bloomfield, who's our head of RPA and our Global for Good lead here at Blue Prism. And then I spoke with Anna Toomey and Elsie Cook from our public sector group. And then finally, I talked with Chieng Martha, who's our VP of Innovation, and Martha Amram, who's the CEO at one of our partners, Glint.ai. So as you'll hear in the interviews, I'll have each of the folks introduce themselves so you can hear a little bit more about them and their background. And then we will jump into the examples that they have to share around how the digital workforce is helping organizations in this time of crisis. So without further ado, let's jump into our first interview with Matt. It's great having you here, Matt. Can you take a couple minutes and just introduce yourself to our audience?
Sure. Hi, everyone. My name is Matt Juden-Bloomfield, and I'm head of RPA here at Blue Prism, but I also am the lead for our global Blue Prism for Good program. And recently we set up a COVID-19 response program, and that's what I'm going to tell you a bit about today.
That is great, Matt. I'm loving seeing everything that's happening around this program. Can you tell our audience a little bit more about the COVID-19 response program?
Of course. So, I mean, let's face it, a couple of months ago, would we be sitting here thinking, oh, we're going to be stuck in a lockdown with a global pandemic going on, and life changed irreplaceably. And the answer is no. Like, this has been a huge impact to our lives. Businesses are affected hugely. We've got a complete shift in the way that we work, live, and even just socialize. Everything's moving online. And so I think we are in a very lucky position as a software business where we are set up to enable people to work from home. We are business as usual. And so essentially Blue Prism as a company and a collective led by our Chief Customer Officer, John Turkoff, has basically issued our COVID-19 response, which essentially says that to any customers, any customers who are currently working with other partners, maybe haven't yet signed a deal, or are people who are just simply completely new to RPA and automation, but are in desperate need of help to help with any processes that have been affected by COVID or could use automation in order to augment your response to COVID, we're asking you to please get in touch. We've got an online web form, which is available on our website. And we essentially ask you to outline what that process is. How is it COVID related? What's the reach of that? Is it going to be local, national, global? Could it potentially save lives? And, what are the sort of areas that it's focusing on? Is it for emergency first responders? Is it to do with supply chains at a sort of government or national level? Is it to do with healthcare and sort of looking at vaccines or getting PPE equipment to the right hospitals? We want to hear all of those different things. And so, you can head to the application form. It's on our LinkedIn page, it's on our website, and we're doing a daily triage every single morning, which myself, Nora Al-Sadani, who's our communities director, and Will Hughes from my Centre of Excellence team. And we're going through each of those for automation opportunities. And once we've got a sort of good grip on what it looks like, we then hand it over to the ExCo. The executive look at that on a Monday, Wednesday, Friday, sort of late afternoon, Eastern Standard Time. And as soon as that gets approval, we then jump on it and get your licenses processed and get you sort of in touch with some services if that's what you've been looking for. So, already we've had 22 approved, and, today is week 2 of it beginning. So far already some awesome progress on all of this. And that, is out of around 50 or so applications. So, roughly half are being approved. But that doesn't also take into consideration there's probably of those at least 13 or so that are still in progress. So, you've got a great chance of getting some help, getting into automation and using our software to sort of really help you. And we really want to be able to use our software to help do some good.
That is amazing, Matt. I know that you are I know you're not on the frontline like the nurses and first responders and things like that, but I would consider you and your team on the digital front line. So I know that it has been a crazy long couple of weeks for you and your team. So I just want to say thank you for all the effort that you're putting in. I know that you guys are making a huge difference just from the stories that I've been hearing so far. So I would love to share some of that with our audience. I know that you're here to share some examples and some cases. We can't use names at this point, but as I'm hearing about these things, I just think it's so valuable for people out there in the industry to know, to understand what's possible. And I think, we're seeing too that, some of the things that are happening now, it's kind of like, invention is the mother of necessity, where we need it now and for this in order to triage all these issues that are coming up because of this. But then, it is knowing that we are going to come through this. It is going to be okay. We are in the middle of it right now. So it's sometimes hard to hang on to that viewpoint. But knowing that, we're going to come out on the other side. And then it's cool to think about how, we will have developed a lot more technologies and solutions on the other side of this that will help us in everyday life. So, would you mind jumping into that and just give us a few examples of what you guys are seeing that is being produced and, how RPA in general, how digital workers are being used in this time of crisis?
Yeah, of course. And I mean, it's such a true point that I think one of the things that many of us come and work for a company like Blue Prism for is that we are really bought into the product and we believe that it can genuinely do some really awesome things. And I think, this is a really tough time for so many people, and, myself included. I'm sat alone in my flat in London, and it's hard. This is week 2 of lockdown, and, my heart goes out to everyone who's been, badly impacted by this. And I think the awesome thing that I love about the product is the fact that, in a crisis like this, we are actually able to show how it can really do some awesome stuff. So, I thought I would just run you through some of the numbers. So of the submissions we've had so far, around a quarter of those are in healthcare. So we've had applications that have been approved and we're currently working on from the National Health Service in the UK. We're working with healthcare providers in Asia. We're also working with healthcare providers across continental US. We've got a number of applications from manufacturing. So manufacturing predominantly PPE equipment to get that to the front line in hospitals, and essentially RPA being used to help track and sort of monitor the supply chain, as well as notify vendors and stakeholders, as well as using RPA to run through purchase orders and invoicing. Obviously, with a lot of back office people unable to really sort of do their job in the way that they were before, or even unable at all because they simply don't have the capabilities to get in onto the systems. The use of RPA there is really invaluable. We've got around 20% of our applications are from public sector, and that's public sector all over the globe. We've had a lot in the sort of space of helping to track the spread of the virus, as well as engaging people in the local community to help them get access to the right care or services they need. So using some form of user interface in order to sort of help channel requests. It's quite tied into local healthcare as well. But one of the good examples from the UK was helping set up people to get e-consultant appointments with GPs or the like, if they hadn't got that service already, and using RPA to set up the calendar invites, to provide the emails, to get the data, to pass the patient information between the various healthcare providers, which is pretty cool. And then we've also got financial services, which makes up sort of another 20%. And that is, a lot of banks globally, which are looking to offer small, medium enterprises loans in order to help them get through this COVID period, or indeed to offer normal householders the ability to go for a sort of interest-free period on their mortgage, or even just to kind of defer payments. And so again, RPA is being used to help triage a lot of those, to read through the applications, to assess the candidate's validity and whether or not that they're a sort of a case that the bank would want to support and help with, and really just to help bring that response time down. And we actually got a really great piece of feedback from a bank that we've been supporting here in the UK at the beginning of the week. So they were issued some additional licenses last week to help them augment their capability, and we were able to help them bring their call handling time down by just over 80%, which is an awesome statistic. So they're now able to help a lot more of their customers a lot quicker and to get through the backlog, which is, the thing that's been really tough. So it's still an ongoing, it's a growing picture, it's emerging, and I think there's a lot of use cases that we can't go into too much detail here on this call, but hopefully we'll be able to shout about it soon. But I think what's been really interesting is just the complete variety of stuff that we're receiving, the sheer scale of where we could really sort of help. And I think it sort of, makes you feel that out of sort of quite a dark situation, that as a community globally, we're able to sort of come together and use whatever means there is to sort of help each other out. And I think no better is that example through our NHS DX site, where we're sort of posting and sharing out skills and objects and stuff that anyone from the NHS is able to then download and access if they've got Blue Prism. And that's, a great way of us sharing that capability and usability among our community, but equally just to sort of to give out and help, and it's free. And that's, I think, what we're also hoping with a lot of the things that we're producing here, is that we share it on with other companies and other industries that might need their help. And so it's a bit of a watch this space, and it's still very much getting off the ground, but we've had a great start so far.
That is amazing. Thank you so much for sharing that, Matt. And just thank you for being here. I really appreciate your time. I know it is the end of the week for you, so I just want to echo my gratitude again for all the work that you and your team are doing, and enjoy your weekend. So thanks again.
Now let's jump into my interview with Anna Toomey and Elsie Cook.
I'm joined today by Anna Toomey, Healthcare Solutions Consultant, and Elsie Cook, Vice President of Public Sector Sales and Alliances, both from Blue Prism. Anna and Elsie, how are you doing today?
I'm doing great. This is exciting times.
Yeah, I can say personally, since this COVID pandemic has hit, it's exhausting. The hours that we're working are just incredible.
I agree. Yes, it's definitely crazy times adjusting to everybody working from home, and even us recording this show. I'm having a little bit of bandwidth issue, so if you hear some audio issues, I apologize in advance. I feel like it's, kind of a global thing right now where kids running in or dogs barking. We're trying to just all roll with it, right? All right. So it's great to have you both on the show. Today, we are going to be talking about how RPA can help organizations in times of crisis. And we'll be focusing on the use cases of both the public and private healthcare sectors. So before we begin, could you each tell our listeners a little bit about yourselves and your background? Anna, do you mind going first?
Sure. And thank you, Lisa. My name is Anna Toomey, and I am a healthcare solutions consultant for Blue Prism. I've spent a lifetime of experience in servicing the U.S. and international healthcare providers, both in the public and private sector, with integration and intelligent analytic solutions that also included robotic process automation, which you'll hear a lot about today, artificial intelligence, and machine learning. And I'm extremely passionate about healthcare. I've worked with some of the greatest teams in public and private sector for the sake of transforming healthcare in America since around 1995. And yes, I started in elementary school. We'll say that. But I joined the Blue Prism team about 9 months ago because I saw the tremendous value that Blue Prism and Connected RPA brings to healthcare and its ability to truly change the future of work for this vertical. I'm excited about this opportunity. I know we're in the time of crisis, and I'm going to be talking about things that we're doing to alleviate some of the stress for so many people that are feeling the stress of coronavirus or COVID-19. But at the same time, I'm excited about what we're seeing in technology and what the results of all of this will be after the crisis passes. So I'll turn it over to Elsie.
Thanks so much, Anna. So my name is Elsie Cook, and I'm the Vice President of the Public Sector team for Blue Prism. Public sector covers the Department of Defense, the civilian agencies, the intelligence agencies, state and local, higher education, as well as the Canadian public sector. And I've been with Blue Prism a little over a year now. And as the daughter of a Marine veteran, I am so proud to serve the people that serve our country. I'm excited to be here today.
That's amazing. Well, thank you both for being here. So great. Well, let's dive into our topic. So I'd love to hear a little bit more about why are you excited about healthcare at a time like this?
Well, Lisa, there's so many reasons, and we'll touch on several of them in this discussion, but primarily because the advancements that I've seen just in the last 2 months since we've been working on this COVID crisis has already proven to be such an experience. Federal support for these new technologies, things that increase speed, efficiency, and accuracy in our pursuit of the detection, prevention, treatment, and prophylaxis of this incident has been phenomenal. As Elsie will talk to, the phones have been going crazy, and we've been getting so much support from federal because they're in such high demand right now. But we've also seen a lot of assistance from technologists from both public and private sector. Everyone is ready to lend a hand. We're all ready to stand up and put our so-called boots on the ground as well from a technology standpoint. And probably I'm most excited about where these changes will lead us once this outbreak has passed. And I know that everybody is kind of in crisis mode right now, but the reusability of these technologies is going to carry us so much farther once we finish the war. We will start a new war with these technologies on infectious disease and chronic disease that we see in the future.
Great. Yes. And I mean, I think that's the way it's always been in history, right? Where there's times of crisis and they lead us to, as the saying goes, necessity is the mother of invention, right? And so,
absolutely.
Yeah, with, traveling to outer space, all the things that now we use related to that. And I think that's, this scenario just echoes that. And Yeah, I too am looking forward to seeing the advancements that will have that trickle down effect. So Elsie, anything to add?
Yeah, I have to say the most interesting thing that I've seen as a result of this COVID-19 crisis is that the community coming together the way that it has. The thing that I'm hearing from our government customers is that they're overwhelmed with vendors and partners reaching in to try to help, to try to alleviate some of the crushing burden that they're under right now. So much so that they don't have the resources to be able to handle all of these altruistic efforts. But it's amazing to see just how strong we are, how we come together during crisis like this.
Yeah, I agree. That's beautifully said. So how is Blue Prism responding to COVID-19?
Well, Blue Prism we are in the mode of taking action, and you'll hear that theme throughout this podcast, but we've launched a knowledge share process for both public and private sector to participate in our COVID-19 response using the latest and greatest in technologies and leading edge technologies. And our goal is to collaborate, then detail, then execute as quickly as possible. We held a webinar just a couple of days ago and launched our Taking Action Blue Prism's COVID-19 response and support initiative. And we're seeing an influx of activity through that collaboration. You can find out more about this on the website under our COVID-19 Blue Prism response. But essentially, the company has assembled a cross-functional team to assess opportunities, choose the ones that are the most impactful at this time of need, and through collaboration efforts, detail out those responses and then move forward on execution.
Great. So let's jump into some examples. What are the use cases that you two are seeing digital workers being used for in response to everything going on around this pandemic?
Just to name a few things that we're looking into, there's examples such as telemedicine. I've never seen such a utilization of a technology, and I'm so excited about it. Even calling my local doctor's office today, they've all gone to using telemedicine. So what better way to have a throughput than to have a digital workforce, and we'll talk about that a little bit, but to go ahead and do all the preliminary and then connect you directly face-to-face with your doctor. It's taking advantage of the most recent leading edge technology and putting it into play at this time that we're all kind of in our own little groups. And one way that we see that telemedicine is so impactful is through working with the call centers, such as the CDC call center or the 211 call centers for people that are possibly being symptomatic or maybe even asymptomatic, but fearful that they've been exposed and that kind of thing. So automating the triage portion of that is one of our hotspot use cases. Also, we're seeing a lot of automation in the pharmaceutical production, which is an avid go-to right now with the ability to get prophylaxis out quickly to those who are not only affected, but those who may be exposed. Of course, we can always talk about use cases in our supply chain management, logistics, moving equipment, PPE, people, and I'll talk a little bit more about that, testing in our labs and the automation of testing in that, even to the point of using sensory automation, which is exciting to me because we all have sensories on our phone. Wouldn't it be nice just to pick up our phone and be able to automatically find out whether or not we've been verified or tested? So there's a lot of new exciting things that are going on, and we are a huge part of that here at Blue Prism.
What is the federal team doing at Blue Prism to assist with the mission?
Well, again, here, Blue Prism is into taking action, right? We've identified several use cases and we're presenting and building out these solutions to federal departments. We've been in contact with the DOD, CDC, VA, and many more, which I could name. But based on our knowledge of the industry and the intricacies of fighting a global pandemic or epidemiological response mission, we've even had them reaching out to us and saying, what can the digital workers do to help us get things moving and get in place? And we've had several discussions with these government entities as well as our technology partners to actively stand up digital workers and take on identified tasks that are mission critical at this time of need. And I have some examples about that, but Elsie, would you like to add to that before we talk about the examples?
Yeah, sure. So, Anna, the thing that is most startling about this pandemic is the impact that it's having, not just on people and how they work, but also how they're getting information, where they get information. There's turmoil. It's confusion. Think about, folks that might have lost their jobs as a result of this. How are they going to get benefits? People that are just that can't make their bills. How are they going to get that money? Those are things that are enacted by Treasury. Think about people that don't feel well and how are they going to find the closest testing center? These are all things that we believe our digital workforce can help with to help alleviate the burden of resources that just aren't there to handle the load. So it's an incredibly exciting time to be able to give back to the community.
Definitely. And, just for our listeners who might not be as familiar with robotic process automation, can you give a little bit more of a detailed example of how does a digital worker help with these processes? Maybe just pick one and talk a little bit about what does it actually look like for a digital worker to become involved with the process?
As a definition, robotic process automation is just that. And for those who are not familiar with RPA, that is taking processes, any kind of process that you can diagram from end to end, and being able to automate that process from a digital worker standpoint, or handing that off to robotics in order to execute that process. So just in that statement right there, you can see the impact that RPA would have on this crisis whenever humans are not available and we have digital workers that are able to do that. But let me give you some examples. One challenge that we've been working on for a possible department is their first responders' first response. For example, there's many veterans in active duty who have pre-existing conditions and are compromised in their immunity to the viral outbreak, but we need those resources, right? So there's a need to proactively identify and locate those individuals for initial triage and direct them to the nearest testing sites. Testing sites are limited during this time, and we want the treatment locations to be identified to these persons that are most impacted, such as those that have pre-existing conditions. So as a solution for that, Blue Prism is able to provide an automated process that connects to the medical database under a medical record system underlying database to identify compromised individuals. And then using evidence-based healthcare guidelines, we're able to cluster those patient populations. The digital worker can identify those contact information and reach out to them, contact them through their mobile and say, you've been identified as a possible risk or at-risk person, and we want to be able to meet your needs. Are you experiencing or exhibiting any signs of distress? And just kind of, it allows the digital worker to actively carry on a conversation with that person who is a first responder and is so prevalent in this time, and say, are you experiencing issues? And if so, then we can direct them to someplace for testing, or we can also send notifications to the testing site and say, we've identified a first responder individual that needs to be given priority service. In those cases, then we can direct them to the nearest testing sites and locations for vaccinations or prophylaxis or treatment as it becomes available. So that's one example. And do you have anything to add to that, Elsie?
Yeah, I sure do. So one of the ideas that we've come up with is looking at supplies that are in such short demand, critical demand, and marrying those supplies with the areas that need them the most. So a digital worker could go in and create a mapping exercise between multiple systems and thereby coordinating various locations, personnel, maybe the equipment and the supplies, and provide recommendations for what the most logical route to send those supplies to those areas in most need.
This is true, and we need to keep in mind that with a digital worker, they have access to any software that a human worker would, and they can utilize that software to make decisions and incorporate artificial intelligence into the picture and make good, decisive decisions with accuracy. So as Elsie mentioned standing up a digital workforce that's actually performing mapping exercises between multiple systems, coordinating location, PPE, where's our testing sites, where do we need people, what is the greatest impact areas, how can we get supplies to those. All of that has been up to now, sometimes even as recent as the last few weeks, a paper exercise. We don't have time for paper exercises at this time of crisis. So what better time than to stand up a digital workforce that can actually coordinate, correlate, and put into a spreadsheet or visible reporting dashboard that allows executives to make quick business decisions on how to get these supplies and people together at the right time in the right place.
You're spot on, Anna. I mean, one other thought is not just looking at what a digital workforce can do today, to help the immediate crisis today, but think about what they could do tomorrow or the day after tomorrow, and think long term. The effects of this pandemic are going to extend into the months, if not year, and employing a digital workforce to literally execute some of these repeatable processes, sometimes at the speed of thought, it's gold.
Well, this is all great use cases. I hope this was helpful to our audience. It's amazing to me, everything. I mean, I'm fairly new to RPA as an industry within the last 6 months. So it's really cool seeing all that is possible. And I'm looking forward to, they always say out of bad things, you have to look for that silver lining. And I think some of this is just forcing the acceleration of business and organizations and the government to look at solutions that are really going to help people long term. And that's what, when we look at the work that we're doing and bringing purpose to it, this really, helps me to know that we're doing something that is making a difference. So it's really cool. So in closing, I would love to hear, what do you have for our audience as far as, key takeaways, or what can listeners do as a follow-up from listening to this show?
First and foremost, individuals be safe. This is a war. We are avidly fighting a disease that is attacking our people. So approach your own safety and that of your family strategically. Follow the guidelines, the social distancing, isolation, cleansing, and awareness at all times until such a ban is lifted. Okay? Keep self-awareness intact. If you're experiencing symptoms of fever, dry cough, difficulty breathing, or if you've been in public places where you feel like you've been exposed, then call the hotline or visit the CDC website for further instructions on next steps and testing. Secondly, from a technology standpoint, think of the art of the possible. Remember that Blue Prism, you have a digital task force that's ready for deployment to handle any mission where humans cannot go. Okay, think about it from those terms. We must think about changing how we do business as a whole, because so many of us are isolated now in small areas. But guess what? I can run revenue cycles straight from my desktop in my office. There are key things that are able to be handled directly and off-site now, which is such an enhancement, such an advantage whenever you have a digital worker at your fingertips. So think about that. Anything that requires speed, efficiency, and accuracy. Being proactive versus reactive, right? Reusability. We've stated that several times in this call, but the reusability of the technologies is going to be tremendous over time, and that's exciting news for me. But if you'd like to see any of this stuff demonstrated or some applicable use cases brought to you, please reach out to us, to Elsie or myself, and I'll let Elsie kind of wrap it up there with our invitation. But it's exciting times for me. I know it's a dreary time, but I still am available for any questions that you may have.
Yeah, thanks, Anna. So in wrap up, I would encourage listeners to do just what the country is doing now, and that is to come together, to collaborate, shake hands with your partners, your partner community, shake hands with your technology community, and together we can pull some really interesting solutions to help the country at large. I'm so excited to see just the good that people have expressed over the last couple of weeks, and it's going to be even more challenging in the weeks to come. So please remember that Blue Prism and our digital workforce is here at the ready to help in any way possible. And thanks for the opportunity.
Perfect. Thank you both. All right. So if anyone has any follow-up questions or would like to connect with you, what's the best way for them to reach out?
So email is obviously the best way to reach me. My email is Laurie, Laurie, .cook, COOK, @blueprism.com.
And to reach me, email is probably the best channel as well. And you can reach out to me at anna.toomey, that's TWOMEY, @blueprism.com.
Perfect. And we'll put links to those in the show notes too, for anyone who's interested. And then I know that we also do have a spot on our website around our COVID-19 Blue Prism response program. So we'll link to that as well. Well, thank you both, Anna and Elsie, for being on the show. I really appreciate your time, and I appreciate all that you're doing for our company and I think for our country. So it's very inspiring. Any final words before we close down?
No, thank you so much.
Thank you, Lisa. I appreciate it.
All right, wonderful. Well, everyone, I hope you have a wonderful, safe, and healthy day, and we will talk to you again soon.
Thank you.
Now let's jump into my interview with Chieng and Martha.
Martha, would you mind introducing yourself to the audience?
Thank you. My name is Martha Amram, founder and CEO of Glint.ai. Glint is a company that transforms documents into data. So we use machine learning to do that. And the two things that people note about us is a super high level of accuracy from the start. We typically, if you tell us what fields you want, we'll deliver about 98% accuracy from the very first set of documents. And the second one is we're incredibly nimble. We're not just doing regular documents, but all the forms and invoices, PDF scans, and faxes that comprise everyday document flows. So accuracy and nimbleness are the hallmarks of Glint, and that's what we can provide together with our partners, Blue Prism.
And Chieng, do you mind introducing yourself to the audience?
Sure, absolutely. Thank you. My name is Chieng Martha. I'm the Global Vice President of Innovation here at Blue Prism. And interesting enough about Blue Prism, we provide this massive scalable digital workforce, but the innovation team that I specifically lead is looking at deploying the capabilities of a Superman down to the everyday business person. And so we try to address the billion-dollar problems in the market space today, the first innovators in that market space. That's one of the reasons why we have partnered up with Glint to help specify and identify opportunities to solve these really tough problems that social, government, and applications and business are trying to address today.
Perfect. Thanks so much. So I would love to just jump in. And today we're talking about how digital workers can help organizations in times of crisis. And I would love to hear from you guys what you've seen so far just around everything going on in the world, how organizations are using digital workers at this time.
Thanks, Lisa. You know, documents are often at the starting point of many workflows and business processes. So what we're seeing is increased document capture with technologies and also increased need to build capacity inside a company where digital assistance and automated data capture from documents can be used to release staff that's currently doing data entry in various ways for a higher calling in our times of crisis. So going back to the first stage, which is capture, folks are faxing documents to hospitals and other settings, attaching PDFs to emails, and often trying to use their phone to take a photo of a paper document. So our partnerships allow us to capture all three of those inbound documents in a very secure, HIPAA-compliant, DoD security level manner, comes into Glint, and then our team and technology transforms that into a stream of data. Now it's ready for the digital assistance provided by Blue Prism to take it down the workflow. We are a Blue Prism technology partner, so that means that the entire thing I just spoke about can be activated within the Blue Prism framework. One click or two clicks, and off we go.
Yeah, that's amazing. And so I would like to add the fact that what Glint is specifically doing is providing the mashing of data, transforming of that paper data into digital data to where we can actually process it at the digital level. And so, perfect example is if you were to go out and look at applying for this new $1 trillion business stimulus package that Donald Trump has put in place. What we could have done is scan all those documents in, have the digital workers read first name, federal ID numbers, and things like that off of that paper document, and then facilitate completing a business loan form for that stimulus package itself. And so there's a number of ways where we can facilitate automation, both at the data capture level as well as just facilitating a business process, because we all know in a time of crisis, speed is important. Accuracy is important, and then being able to respond and adapt to a changing environment is definitely important. And so this is where we can provide those three critical areas from a Blue Prism perspective with Glint.
And just to follow up on something Chieng said, we know that certain parts of our workforce are way overloaded, like people who are processing loans inside the SBA, or people who are typing in data from faxes inside clinical settings. At the other side, and those workflows we don't want to disrupt. No one is ready to adopt a new technology or digital worker right now. But on the other side, externally, a lot of that workflow can be pre-prepared, and that's what this partnership can offer. So going back to loan applications, it can be that the digital worker does the check on, is the documentation fully complete? Are all the documents there? Are the fields filled out? And a digital worker can also do a logic check. Does this loan application meet the screening criteria for first and second conversations? So with that in hand, we can enable internal workforces who are just way overloaded to do their jobs more easily. So inside or outside organizations that are trying to stretch capabilities, this partnership can help.
That sounds great. So do you guys feel complete around that use case?
Chieng, you said something to me earlier today that I think is so cool, that this partnership brings the same high degree of professionalism and automation and ease of use that's used by Fortune 500 to others. And the others we could now define as smaller businesses and public entities, and just kind of really go down to the cities and the states and the locales in that way by saying, hey, we're bringing this high class stuff to a broader audience, and why this partnership can do that.
Absolutely. I think that's important because when we start to look at not just the use cases themselves, but just the quality of the technology that's available, Blue Prism traditionally has been focused in on the global 2,000, 5,000 large businesses per se. Intelligent automation has been primarily focused on very big scale type of repetitive process, and then that incorporates new technologies like Glint to make this process more intelligent. But what we're specifically looking at in a crisis situation is how do we apply this type of high-level, very scalable enterprise-level technology down to solving crisis at the local and regional levels beyond just what a Fortune 500 company is doing. And so I think that's important to understand that we are all working from home for the next possibly 30 days or 60 days, depending on our local governments. But I think what's important to understand is that the use cases themselves, above the loan applications and things like that, it's just the ability to work more efficiently because we are working remote. With the digital assistants, we can also facilitate business validations. We can actually have digital workers read through these customer calls, emails per se, and facilitate prioritization of those versus just going to a random inbox and then whoever gets it to first can respond. So it's finding new, more efficient and effective ways to manage workload with a limited staff and then respond appropriately to the crisis.
And I think you've just said something super important, which is there isn't a current workflow and there's very limited staff. So how can digital assistants just essentially amplify the current workflow? We're not asking to submit a rewiring of their workflows while working remotely. It's more what was your workflow? How can we help you get the bits and pieces of it done so that staff is relieved of time and can go on to better things?
Yeah, I think that's important too, because traditionally, most of these enterprise level technologies have been taking years to, and possibly some decades, depending on the old ERP systems, the implementations 20 years ago. What we're suggesting specifically with intelligent automation and Glint is the fact that we can deploy this within days, if not hours. This is really important because the environment is changing so fast, whether that is a healthcare crisis or maybe it's a natural disaster. We want to be able to make sure that whatever those business processes are that's operating today is not dramatically impacted in trying to re-engineer things as they are occurring. What we're suggesting is additional workload, additional scalability, and additional capacity to do that work, and let people do what people do best, is respond to human needs.
And finally, because it's so easy to get started and it's so rapid to get started, as Chin said, what used to be sold to the Fortune 2000 can now also be used in this period by folks in smaller companies, local government, county, state parties, and folks who need an outside workflow to increase the capacity of an inside workflow. We'd love to hear from you and build out those use cases in a matter of days and hours.
Absolutely. I think the call to action here is specifically helping the audience help us identify those things that will help them be more flexible and adaptable to whatever may occur in the future.
That is perfect.
So here at Blue Prism, we just recently put together the COVID-19 program. This is an executive initiative at a global level to help all the different parts of the world respond and adapt to this virus that has occurred that's impacting the human population globally. And so this program specifically is looking at identifying high impact use cases in areas that are affected dramatically by the COVID-19. What then Blue Prism will do is work with our partners like Glint to facilitate and work with the locals in that region, in that area, to solve whether that's supply chain issues, healthcare issues, wherever we can facilitate additional worker to assist in saving lives. And that's really the focus over the next 6 to 12 months.
Perfect. And we will have a link to that program in the show notes. So if you'd like more information, you can click on that. And you can also access it through blueprism.com. Our homepage has a link to it as well. All right, perfect. Well, I really thank you guys so much for your time today. And I appreciate everything that you're doing, even just having people understand, what's happening, and being able to help is, I think, critical in this time. So thank you both for your time today. And I really appreciate it and look forward to working with you more in the future.
All right, thank you.
You've been listening to Generation Digital Workforce. If you want to hear more about RPA, AI, and other cognitive technologies that are shaping the future of work, join us next time as we continue to go deeper on these topics with industry innovators and experts. To make sure you never miss a future episode, subscribe to the show in your favorite podcast player. And if you've liked what you heard today, please leave us a review. It's one of the best ways to help more people find valuable content. For show notes and more info, visit us at blueprism.com/podcast. Thank you so much for listening. Until next time.